I'm Christine Tran. My student number is 16979866. And today I'll be discussing the LGBTQIA plus groups health. And today we'll be looking at their cultural beliefs, health issues, and s- evaluating their health provisions and also strategies to further improve outcomes. So a bit of a background with this group. So the LGBTQIA plus is an acronym and it stands for lesbian, gay, bisexual, transgender, queer or questioning, intersex, asexual, and plus that includes other diverse sexual orientations, gender identities, and expressions that are not explicitly listed. Again, historically, the LGBTQIA plus people have experienced marginalization, criminalization, and pathologization across many cultures. Since the late 20th century, there have been improvements in visibility, advocacy, and legal protections. Stigma, discrimination, barriers in healthcare, education, and employment still exist. LGBTQIA plus identities are shaped by cultural, social, and political influences. People's experiences are also intersect by race, class, and geography, and many other determinants. The acronym reflects a commitment to inclusion and diversity. This is a little a photo. This is a little picture about what intersectionality is. It's basically governed by religion, age, race, sex, education, sexuality, income, culture, geography, gender, disability, or any other intersex variation. So, health beliefs and behaviors about this group. So there's heteronormative assumptions in healthcare that often lead to this group of people to conceal their identities or be less open with providers. Stigma can make people feel judged, resulting in delays in seeking care. For those also facing racism, ableism, or disadvantage, the effects of stigma are even greater. Stigma can lead to social isolation, limited access to services, resources, and increased stress. This contributes to ongoing health inequities and less engagement with healthcare overall. Fear of discrimination causes many LGBTQIA plus groups and people to hide their identity, making them less likely to access healthcare or share information with providers. Exclusion from mainstream health education also means a lot of them have less knowledge about safe health practices, which then engage in higher risk behaviors or rely on peers instead of professionals. The ability to express identity openly often shapes how and when people seek care. Uh, Now we'll go over to the key health issue, number one. That's mental health. So LGBTQIA plus people have significantly high rates of depression, anxiety, and suicidality compared to the general population. This is about 57%, or two-thirds have experienced a mental health condition or high psychological stress. This is often driven by stigma, discrimination, and the stress of being a minority. High burden of stress when combined with racism or ableism. Many people avoid seeking help because they fear or have had previous bad experiences with the healthcare system. Mental health issues can also lead to harmful coping behaviors like alcohol use and other substance abuse. The second key health issue that I've also included sexual and reproductive health. Gay and bisexual men, as well as trans women, face higher rates of HIV and STIs. Meanwhile, the lesbian, bisexual women and trans men often face barriers to services like pap smears or fertility treatment due to assumptions based on heterosexual norms. Health campaigns often exclude LGBTQIA plus people, leading to mistrust and less engagement. The PrEP has helped prevent HIV, but access is still unequal due to stigma, cost, and rural access. Many providers also still lack training in inclusive ethical care. Um, the current healthcare provisions that we have for mental health uh, is that there's a health and well-being action plan or strategies that was set with clear system goals. What's also working is that in those strategies, there's peer-led services like Q Life, gatekeeper training, which basically provides safe cultural competence support. Um, Frameworks are expanding with specific training with other partnerships as well. And there's also more trans-inclusive guidance with community-led sexual health resources. Uh, with healthcare disparities, mental health distress remains high in the LGBTQIA plus community with high suicidal rates. One issue is that sexual orientation and gender identity data is not collected consistently. Let me start again. Healthcare disparities. So starting with mental health, the mental health distress remains high in this community with high suicidal rates. One issue is that sexual orientation and gender identity data is not collected consistently, making it hard to measure progress. Rural and intersectional communities face big access gaps. While policies exist, still many mainstream services are still not inclusive. In sexual health, PrEP uptake is still uneven among young people, especially in migrants and trans women. Many professionals also lack the cultural competence needed for quality care. So, what strategies could improve? Uh, so two key areas for improvement. First, we'll need to have more inclusive services through community co-design. This includes expanding peer-led programs, as mentioned before, like the Q Life and the gatekeeper training, and basically collecting standardized data for improving access for regional, trans, the culturally and linguistically diverse First Nations people. Mainstream services must adopt inclusive practices such as using correct pronouns and anatomy-based screening. And second strategy would be increasing visibility, accountability, and workforce reform. Inclusive health initiatives should be funded and cultural safety should be built into workforce training and capability frameworks. In conclusion, LGBTQIA plus health outcomes are shaped by stigma and systemic barriers. Mental and sexual health disparities highlight how healthcare systems often still fail to meet the community needs. What's needed is inclusive, culturally competent healthcare, better data, stronger policy, and the empowerment of LGBTQIA plus communities through peer-led support. Just basically improving health outcomes for LGBTQIA plus people is not just a clinical issue. It's a matter of equity and social justice. Thank you.